Good afternoon. My name is Sean Daraff, and I'm the Research Coordinator at the BC Centre for Employment Excellence. On behalf of my colleagues at the Centre, I would like to welcome you to today's webinar. For those of you who are unfamiliar with our Centre, or the CFEE as we like to call it, it was created in 2012 with funding from the provincial and federal governments to act as a research and knowledge sharing organization for BC employment service providers and employers. The Centre's mandate is not only to do innovative research, but also to find ways to share that knowledge and best practices with BC practitioners and employers. Today, we are pleased to present the last webinar of our three-part series on understanding current employment programming and services for BC youth. Last November, the Centre issued an open call for researchers to submit proposals to explore barriers affecting BC youth employment from a variety of angles. The purpose of this call was to provide new insights and understanding into the challenges that youth are facing in the labor market and to identify promising solutions for such issues as supporting youth who are entering the workforce or helping them find work that is a better match for their skills. Through the call, the Centre was able to support 5 projects that tackled such issues as the barriers experienced by vulnerable youth, as well as youth living with mental illness, which you're going to hear more about today, the role that employers can play, and the promise that work placements and social enterprises hold in addressing work transitions for specific populations of youth. The teams have completed their work, and we are pleased to be highlighting the results of the research through this webinar series. Today, Dan Huang-Taylor and Isabel Eaton will be presenting on their study regarding the labor market challenges faced by youth living with mental illness in the Lower Mainland. Dan is a supervisor for youth employment programs with the YMCA of Greater Vancouver. Dan has been working in the employment sector in a variety of capacities for the last decade before settling happily into the career development field with the Open Door Group. As a job developer, he gained his first exposure to working with youth with physical, mental, and learning disabilities. Since then, he has managed multiple federal and provincial employment programs, which have been primarily disability and youth-oriented, both with Open Door Group and now in his current position at the YMCA. Isabel was the lead researcher on this project. She has worked in applied social and education research for nearly 11 years, first with the Canadian Council on Learning and later with the Directions, Evidence and Policy Research Group, of which she was a founding partner. Prior to these positions, she was an associate director of SFU's Imaginative Education Research Group and worked extensively as a program and performance evaluation consultant for British Columbia's social services sector. Earlier in her career, she worked for some 10 years as a counselor in youth residential centers and group homes, first in Quebec and later in British Columbia. Before I turn it over to Dan and Isabel, I should note that the presentation will last approximately 25 minutes. Due to time constraints, we will hold off on answering questions until afterwards. At any time during the presentation, we invite you to use the questions feature on your dashboard to submit any questions or comments you may have for the presenters, and we will address them during the discussion period afterwards. I should also mention that we are recording the webinar today, and we will post a video on our website along with a link to the presentation slides, with further opportunities for everyone to continue the conversation with the presenters and other practitioners. And now it's my pleasure to hand the mic over to Dan and Isabel.
Thanks for the introduction there, Sean, and also thank you to the Centre for giving us the opportunity to conduct this very worthwhile study. It was a great pleasure to do so, and we're very happy to be here to talk about the findings, the results, things we learned. In today's presentation or webinar, we will be covering the background of the research study, the study itself, the data analysis, and some recommendations that came from the findings of the study.
One thing we did want to mention is that both Dan and I have a big aversion to reading directly from slides, so you will be seeing some content on the slide that we all trust you are very capable of reading, and we're going to be highlighting some of the things that are most important to us. By all means, afterwards, if there are things that you'd like to go back to, we'd welcome your questions.
Okay, so obviously the story of youth unemployment is not a new concept. Young people who face specific barriers to young people unemployed people who struggle with finding employment find a significant added barrier when they face the challenges such as mental illness, and when it comes to retaining employment, those challenges can be even greater. So for us, it makes a lot of sense to focus on this particular group of youth and the issues that we saw that came from the study that we conducted. We were correlated very closely with some of the findings that we looked at when we were conducting the initial research. So, such as youth are at a far greater risk of developing mental illness than adults, and employment is known to be a key component of recovery, and known to lead to better functional outcomes and a reduction of mental illness-related symptoms. Mental illness makes it harder to find and keep employment, and the rate of unemployment on average is 10 to 15% higher for those living with mental illness. So just a little bit of background information regarding the WISE program and why we took specific interest in this particular study. We were interested in learning more about the experiences of youth living with mental illness with respect to finding work and participating in employment preparation programs. Interest came from the youth that we were seeing in our programs due to the fact that we were seeing higher number of drop-offs with that specific population than with any other participatory group who would actually be accessing our programs. So this has been something that we'd picked up on over the years of delivering these programs, but in the last couple of years, the two services that I was involved in delivering, Youth Job Match and Youth Skills at Work, both of which worked with youth with multiple barriers to employment, but a whole range of barriers. It was among those youth with mental health concerns that we saw just a higher number of dropouts, and this could be pre-employment, post-employment, during the time that they were accessing the program as well. So this was obviously something that we wanted to delve into, as it was such a significant and noticeable number that was dropping off. In delivering the program, when working with employers and career developers, we noticed a number of different themes that kept on coming up, and we will be speaking to these further during the presentation. But among the themes among employers, they'd speak to the risk of hiring youth with mental illness, or concern over the quality of work that they might be getting, workplace perceptions such as the stigma that exists around mental illness, a lack of understanding among staff, and not having the resources to provide adequate support. And then from the career developers as well, we were hearing that they are often the most challenging participants to work with, and they saw programs like ours as almost a last resort for them to be working with the client that they had been working with for so long. And when it came to when they wanted to work with employers, they saw a lot were very unwilling to consider even hiring someone with mental illness.
So we've had up on the screen for a couple of minutes now, as Dan was speaking, some quotes that were extracted directly from the interviews that we conducted. And these are statements that were made by some of the youth informants in our study. And you're going to see some of these show up throughout. We were not going to be reading through them systematically, but our intention was to try to really bring forward what it looks like from the perspective of the different types of informants that we had in our study, that is youth living with mental health, career development practitioners, and employers, to be struggling with some of these issues that circle around mental illness and finding employment. So let me quickly take you through some of our guiding questions. And again, I won't go through these systematically, but these were the kinds of things that we were interested in finding out as we went through our research, and they kind of guided both the questions that we asked of our informants and the ways that we then looked at our data. And as you can tell, they kind of try to hone in on different aspects of that interplay between mental illness and employment. We wanted to see if what was known to be true about the relationship between mental illness and employment was true for youth living in the lower mainland region of British Columbia. That was certainly a big focus for us. We wanted to see also and learn more about what else might be going on for those youth and what might be compounding the challenges that they're facing when it comes to finding work. And we wanted to see if the youth's perspectives were aligned with those of the career development practitioners, which we'll often refer to as CDPs in our presentation, and employers. And that kind of naturally led into a question about whether or not the quote-unquote typical types of pre-employment programs are actually well suited to meeting the needs of youth living with mental illness and or employers. Now, I should be clear that we didn't evaluate those programs per se, but we wanted to see what would surface so that eventually we could hopefully help inform programming a bit better.
Okay, so we're just going to give you a brief overview about what we actually did to collect this information. So first of all, we recruited through a lot of our pre-existing relationships that we had with the service providers within the region. We focused our recruitment to the lower mainland, and we're working with a number of different service providers who not only have access and experience of working with youth living with mental illness, but they themselves were an important stakeholder in this study. So we were reaching out to the resources and our connections within the community, and of course the same went for the employers as well. We've developed relationships obviously with a number of employers through our time delivering employment programming, and we were able to recruit through those contacts as well. Our goal was to take a qualitative approach to this study. We wanted to conduct in-depth research with the stakeholder groups that we were talking to, with a goal of 10 to 15 youth participants and 5 to 8 participants in each of the career developer and employer sectors as well. And as well as just to give you a little bit of information about the interviews, we would conduct those in person with our participants, with the youth, but ideally we wanted to try and connect in person, face to face with the other groups, but it wasn't as easy for us to achieve that. And as well as the interviews, we also conducted a focus group, which Isabel will talk about now.
That's right. Thank you, Dan. We also plan to conduct a focus group session that was done on the format of a World Cafe, where we invited contributions from various groups in kind of iterative cycles. Originally, our plan had been to focus primarily on CDPs and employers, and we were very pleased to discover that there was an appetite to involve the youth in that discussion as well. We approached some of our interview informants or interviewees and asked them if they were willing to be part of the focus group. And I think in total we ended up with about 12 to 15 participants, which out of the total number of informants that we had was actually quite encouraging, and there was certainly a strong appetite to discuss some of these issues. You see on your screens now a little bit of demographic information about our informants. I'm not going to go through these bullet by bullet, but there are a few things that I want to focus on. Our goal was definitely to try to recruit as many youth between the ages of 15 and 24 as possible. As you can anticipate, they're actually, even though when the group is defined like that, it's actually quite diverse, because you've got informants who would qualify definitely as youth under 18 receiving services targeted at youth, and those who would already have been in the adult stream. But we were willing to expand our definition of youth up until the age of 31, because a growing number of studies and statistical reports use that more expanded definition. So you can see how our respondents broke down in terms of age. There are some noteworthy things about our group of informants that I do want to surface as well. You can see that we had nearly 3 times as many female as we did male informants. And that may be a reflection of either how mental illness is diagnosed in certain youth populations, and also the willingness of the different gender groups to speak to issues of mental illness. no one in our study had actually completed post-secondary education. And I think it's something to bear in mind when we look at employment issues. We had some informants who had had some post-secondary, but nobody with an actual degree. All of our youth informants were living in the Lower Mainland, but they had not necessarily always lived in the Lower Mainland. We had some people who had immigrated from outside Canada and some people who had moved from within British Columbia. Finally, as far as our CDPs are concerned, all of them reported having had some training with regards to working with people suffering from mental health issues, but very few actually had some sort of formal preparation in place. And another thing of note is that our employers to whom we spoke were primarily small businesses and from the retail and service industry. So we wanted to surface that because we think it's important that when we get into the actual findings, you take into consideration who it was that we had spoken to. The next slide shows you how we coded our data, and everybody has better things to do on their lunch hour to discuss data coding, except certain of us who are really obsessed by these things. But we wanted to show you the kinds of aspects that we focused on that you'll see come up again when we actually go on to talk about our findings. So if you have any questions about this, by all means I would encourage you to call them at the end, but this is kind of our due diligence piece. So let me tell you a little bit more about what it is that we learned. See, I told you what we learned. So when it comes to barriers to securing employment, these were some of the primary barriers that were surfaced with regards to actually basically being able to get yourself into the door and getting the job. So a sense that maybe youth living with mental illness might be lacking in demonstrable experience that is relevant to their work, that their expectations might not necessarily be aligned with what it is that is available to them, that the overall scope of their education, skills, and training might not necessarily be a right fit, and also that a number of people seem to be under-equipped with respect to general job search readiness skills. Now, there was some variety in there in terms of whether or not youth were talking about this and the career development practitioners were talking about this. For example, I'd say that it's fair to say that the youth had a general sense that their job search skills were pretty good, and the CDPs might have had some differences of opinion about that. There was one, to my mind, rather interesting paradox that came up, and that is that the youth are keenly attuned to what it is that will let them get into the door when it comes to employers. They're really concerned with how to make themselves look good on paper, whether this is in terms of their education or their past work experience. And a number of our informants were very straightforward in letting us know that they won't hesitate to withhold information on what they believe could somehow make them look bad when it comes to securing work. This is not so much deliberate lying as it is sins of omission, if you will. They don't want to have their resume raise questions about their mental health. So either a spotty job history or a large number of transitions over a short time period to their minds would be a flag that maybe they're not the best people to consider for a job. That doesn't necessarily mean, however, that they know how to present themselves in a way that will make them look advantageous to an employer. So they know what not to say, but there is definitely a struggle there with what it is that they should be saying. Almost all of the youth we spoke to were very clear on the fact that they want to increase their level of education to be more competitive in the workplace, but they're not entirely sure how to do so while balancing the need to secure an income and the needs associated with managing life with a mental illness. And you can see from some of the quotes that are up on the screen right now what the experience of trying to get hired felt like for some of them. The employers that we spoke to, and again, that may be a function of the sectors that we were looking into, but they seem to be surprisingly unconcerned with youth individual record of education or experience. They generally felt extremely prepared and ready to make up for any deficiencies that youth may have had in the areas of specific skills, and to do that in the workplace. What they were after seemed to be more familiarity with workplace practices and expectations. So if you will, a sense of what a quote-unquote good work ethic would look like, what it means to be professional. And I would say that there were some definite unmet expectations in that regard between what the employers reported seeing and what many of the youth felt would work for them. So barriers to retaining employment. I think that the very first one that's mentioned there, willingness to disclose, and obviously in this case we're referring to willingness to disclose about mental illness issues. Obviously that is something that would show up as a potential barrier to securing employment, but it was definitely one that showed up when it came to retaining employment. Youth living with mental illness, quite simply, at least the ones we spoke to, are not keen on disclosing that they live with mental illness, and especially not during the job seeking or interview phase. In their mind, it is clearly perceived as something that will not get you hired. And we heard from some career development practitioners that they actively discourage youth from disclosing that they may be living with a mental illness, because in their mind, again, that's just going to shut the door. Ironically, we heard from almost all of our employers saying that they would welcome knowing more if mental illness was an issue, because they felt that this would help them plan, create the kinds of opportunities for accommodation that somebody living with mental illness might require, and create a climate of understanding. But it does beg the question of how you go from not saying anything during the interview to then raising it once you're hired. The fit and the nature of work was also an issue that came up. Most of the jobs that appeared to be available for youth, and I'm not basing this here on what the employers told us, but what the youth informants told us themselves, they tend to be low-skilled, dead-end jobs, to put it bluntly, that aren't particularly engaging. And there was a weird paradox that came up when we were listening to what the employers were saying, because on the one hand, some of them seemed to be criticizing the youth for being overly ambitious with respect to what they would get in terms of a job given their level of education, their level of experience. And yet they were also criticizing them for not being particularly engaged in the jobs that they were doing. So there was a kind of mixed message there that somehow the youth were supposed to come across as ambitious and wanting to rise above things, and yet remain very much engaged in jobs that might not have felt that engaging to them. In addition, when you're talking about retail jobs and jobs in the service industry, often these jobs will involve either high levels of interaction with the public and or shift work, and in both cases, depending on the type of mental illness that is involved, this can be seriously detrimental to the well-being of some people. So you see here on the screen a couple of additional quotes that kind of surface what it feels like to be talking to your employers from the youth's perspective about mental illness issues that you might be living with. With respect to CDP preparation and unmet needs, both from the CDP side of things and the youth things, I think what we wanted to surface more than anything else was that what we heard from our CDPs is that it felt like they were often having to work around youth issues rather than actually being able to work on the issues that might be stopping them from getting work and or maintaining work. A number of CDPs reported that their roles felt constraining and that either their mandate or their funding would not let them take care of the full spectrum of needs that youth have. In addition, a number of our CDPs reported having preparation that felt highly uneven in terms of effectively supporting people living with mental health. So you can see again from some of the quotes that we have on our screen that some of those difficulties are surfaced and very much present in the day-to-day experiences of career development practitioners. Finally, with respect to employers, there were a couple of interesting things that we wanted to surface. There's a definite willingness, at least on the part of the employers with whom we spoke, to talk about mental illness. But what isn't clear is necessarily what mental illness in the workplace actually means. So there's an openness there, but a lack of knowledge, and they're not too sure how to figure out what it is that they need to figure out. There was a problem that was surfaced by some employers as well with regards to the simple reality that the person doing the hiring may not be the person who's doing the management of employees in the room. And even if stuff were to be surfaced at the interview stage, it doesn't mean that the person who's actually supervising employees would be in a position to know how to handle things like accommodations, to provide support. In addition to that, and we're nearing the ends of our findings here, a number of employers seem to suggest that they really weren't clear on what it means to actually accommodate people in the workplace. I think somehow accommodation around physical disabilities might be easier to handle, but around mental illness there was a real preoccupation with being fair, and being fair seemed to be very often that you treat everybody equally and give them the same opportunities. Of course, if you've got some employees living with mental illness and others who aren't living with mental illness, it begs the question as to whether or not you can actually achieve accommodation by treating everybody exactly the same way. Finally, the only thing that I would point out with respect to the employers is that it wasn't always clear whether or not they could distinguish between an issue that might arise in the workplace as a result of a struggle that an employee is having with respect to mental illness, what might be simple inexperience regarding workplace expectations, and what might be visible when an employee simply isn't engaged because the nature of the work isn't appealing to them. And you could tell that employers were really struggling with that and trying to parse out what bucket to put it into. So I'm going to turn it over to Dan so that he can speak to some of the recommendations that we saw come out of our study.
Thanks, Isabel. Okay, so when upon completion of the study, we grouped the recommendations into the three different stakeholders that participated. So our CDP, employer, and obviously youth respondents. So first of all, just in looking at the career developers, one of a couple of the things that we had noticed that had come through from our conversations with our career developers was the difficulty that they encountered when it came to the actual outcomes and reporting the successes of the youth that they had been working with. It's something that an experience that we echoed within the Y as well. In current programs and past programs as well, we've seen many differences in the way that we report back measurable outcomes, like what constitutes an employment outcome, reporting requirements, the time that we have to work with the youth participant, follow-up timelines, etc. So we felt that consistency around some of these measurables might actually help us identify what is constituting effective programming right now. One of the other areas we were looking at, and I'm going to speak to this in a little more detail in a few slides, but a centralized resource, this will look like something akin to a Work BC employment center, if for those of you who are familiar with them. But like I said, this is something that I will go into a little bit more detail in shortly. And finally, within the career developer recommendations, and this came through a few people we spoke to, but it's also something we've experienced as a service provider ourselves, is being able to provide funding, being able to provide services on an ongoing basis. We've worked in contracts that have lasted for less than a year, and that's resulted in a development of a program that might be working very well for the service provider, but particularly the youth that we're serving. And after that short period of time, the services end. We lose the connections with the community providers, our youth participants, and the employers as well. So seeing something, a service that could be maintained over a longer period of time, which serves to specifically help youth, would be something that we would see as a positive outcome and a recommendation from this study.
I'll very quickly go over 3 concrete recommendations for employers that emerged from our results, and you can see them on the screen. One of them would be, and it probably comes as no surprise given what I was just saying we'd heard from employers, for a centralized repository to share information about programs and supports. Now that could run the gamut from programs and supports that have to do with helping employers learn about mental illness and mental health in the workplace, but also even down to the concrete level of perhaps types of funding that might be available to them to support employee accommodation in the workplace. The second point wasn't necessarily raised directly by our informants, but it became obvious to us that having a program in place, a designation program that would help employers self-identify as mental health positive, somewhat similar to what the LGBTQ community has done with respect to businesses self-identifying as being friendly to that community, could be a way of creating some transparency around the discussion of mental health and mental illness in the workplace. And finally, providing workplace-based mental health coach or advisor services that would be available to employers to support them in the day-to-day management of employees living with mental illness, we feel would be a good thing.
And finally, some of the recommendations around youth, and once again, I'm going to speak to the one of the overarching recommendations that came from this study shortly. But first of all, the knowledge mobilization. So the need to connect the findings of studies such as this one to some of the issues raised by the various stakeholder groups, and seeing some really meaningful action that comes from these. And as an additional research recommendation, we found that looking further into the role that social and familial supports during the elementary to high school years in the development of vocational readiness to creating healthy youth and young adults could be something that would be very worthwhile as well. So finally, the hub, or the integrated service model. So like I was saying previously, this is something that we would see similar to a Work BC center. So not dissimilar to that. We would be looking at this as a service that was catering exclusively to youth, and providing a full range of specialized supports, which would include counseling around mental health, drug and alcohol, street involvement, housing, and employment and training, of course. One of the key elements of this would be the opportunity for youth to connect with peer and mentor supports. We see this as a very big piece of the center, recognizing that there are a number of different resources that already exist for youth within their communities. A lot of these don't address the range of issues that that youth might be going through at any given time. We would want to be creating a safe environment where they can connect with people who they can relate to, but also where they can find the necessary supports that they would need to get the help with whatever issues they might be facing at that time. I mean, from our own experience, our program staff have developed very strong ties with a number of specialist agencies. And this is usually through the need to refer out once an individual's need to deal with their health becomes a priority over actually finding a job. We stay in contact as much as we can with these individuals, but most of these connections are very hard to maintain. So the hope is to see something like the hub as a centralized system whereby these individuals can receive complementary supports in one place, and then they don't get lost in a network of agencies, only to find themselves back at the beginning. So that's one of the main recommendations that came from talking to the youth who participated in this program. I think you also had something as well. No? Okay. So, and that ends our webinar, at least our portion. Thanks very much.
Thanks, Dan, and thank you, Isabel. We have time for just a couple questions. Isabel, you asked folks to ask any questions about data collection, if they had any, and we've got an eager respondent here. who's asking, with your limited sample size, what can you say about the results' validity and reliability, the representativeness of your sample here?
Qualitative studies like this don't aspire to reliability or generalizability. What we're trying to do with an approach like this is to really get a sense of what it looks like for people. It's not to say that this doesn't form the foundation for something that could be extended to a larger population, but it's, if you will, simply not a factor. Having said that, the fact that we managed to get about 25 people who took part in our study over what was barely a month, and get a range of perspectives thrown at us from youth, from career development practitioners, and from employers. And the fact that there were some areas of commonalities, I think, suggests that there is a good basis from which to go. But like I said earlier, certainly take into consideration the demographics of our informants and understand the results within those parameters. Great question, by the way. Thank you.
Okay, well, the second question is about your sample itself. You talked a bit about your recruitment methods. How did you select your respondents, and were they self-disclosing or were they self-reporting their mental illness to you?
Dan and I were waving at each other there as to who would take it. If you have specific questions, additional questions about the recruitment process, certainly I will let Dan speak to that. But we did, Sean, could you run it by me again just quickly?
Well, were your participants self-disclosing?
Yeah. So we did ask them, and we certainly left it up to them, but they were self-disclosing in the fact that we certainly didn't go looking through anybody's medical files. They weren't necessarily recommended to us on that basis. It was important to us that the youth in our sample either have a formal diagnosis in place and or a history, self-reported history of mental illness. The basic question was whether or not they had a history of mental illness. We did then ask them if they were willing to share the nature of their mental illness, but it was certainly not a requirement that they tell us what the nature of the mental illness was, and we didn't limit it to specific types of mental illnesses. In addition, we did not exclude people who may have had other disabilities, whether cognitive, developmental, or physical, but there had to be either a formal diagnosis or a history of mental illness in place.
And just to add to that, we were recruiting through our own programs, programs that we were presently delivering, and also previous programs. So we did have a personal relationship with some of the youth participants, and we were aware of a formal diagnosis in some of those cases. That didn't constitute the full sample, but there were a number of youth within that group. As well as that, we were speaking to the folks working in the Work BC centres for referrals for this study, and in doing so, we were recruiting with the mandate that we were looking for people who did have a mental health diagnosis. So there was some reliance on those referrals as well, and confidence that the referrals were appropriate.
Great. Well, thanks. I'm cognizant of the fact that we're running out of time here. We have had some other questions come in, and if you have any further thoughts or comments for the presenters, you'll be receiving a link to our blog where we'll be posting the recording of this session, but also an opportunity for you to ask your questions there. I just want to make a few quick announcements before we end today's session. When you leave the webinar, you'll be asked to complete a short survey. We'd really appreciate it if you would take a minute or two to share your thoughts, as your feedback will help us immensely in planning future events. If you are on our mailing list, you would have learned that all 5 of the youth employment papers, including the report that Dan and Isabel presented today, are now available on our website. Click on Youth Employment under the Research and Innovation menu item, and you will find summaries of each of the papers, links to download the papers and presentation slides, and recording of all 3 webinars in this series. The Center has been pleased with the amount of interest in this project, and we are having ongoing conversations with our stakeholders about opportunities for conducting further research based on the findings from these studies. In addition to contributing to our stakeholders' knowledge and understanding about the issues that various groups of youth are facing in the BC labour market, A major goal of this research project was to identify new ideas and approaches for the center and its partners to investigate further. We invite you to connect with us if you have any thoughts or suggestions on where we might go next. We also encourage you to sign up for our mailing list and watch our website for upcoming announcements regarding our future research initiatives. I should also let you know that you should mark your calendars for October 22nd for our next webinar, where our colleagues at the Social Research and Demonstration Corporation will be presenting new research on the effectiveness of offering essential skills training in the workplace. We'll be opening up registration for that event shortly. That ends our event for today. On behalf of our presenters and my colleagues at the center, thank you and have a great afternoon.